Obviously, we're all becoming Zoom experts here. I want to thank everyone for joining us today. We have well over 400 participants today. That's by far the best attendance that we've had on one of these calls. Obviously, it stresses the importance of the times that we're in right now and the challenges that we have. I want to thank Freeholder Morey and also Judge Donahue for being on the call today and for their willingness to take your questions. It's not an easy job, so we thank them for all their hard work. I know they've had a lot of sleepless nights here, and we thank them for reviewing the reopening plan with us today. I also want to congratulate and let everyone know Vicki Clark's been named to the Restart and Recovery Advisory Council for the governor. So I want to assure everyone that Cape May County has a very strong voice as we look to reopen our economy. So with that, Vicki, congratulations, and the time is yours, as you like to say.
Thank you, Doug, very much. I appreciate that. And, we'll do our very best to represent the interests of everyone on this committee. And I just, since you mentioned that, we'll share that I'm really thrilled to be joined by Freeholder Morey, Brendan Sciarra, and Curtis Bashaw, also distinguished colleagues from Cape May County serving on the Tourism and Entertainment Subcommittee that the governor appointed. And we had our so with that, I just would like to again welcome everyone and thank you for joining our town hall meeting this morning. And we're thrilled that so many of you are sharing a part of your day with us to learn more about the reopening and recovery for Cape May County. And the purpose of today's program is to discuss the proposal for the safe, thoughtful, and progressive reopening of the County of Cape May in the time of COVID-19. We thank all of you who submitted questions in advance, and because there were many of the questions that were duplicated in general nature. So your specific question may not actually be answered, but the overall context of most questions are going to be covered either in the introductory remarks of our speakers or the questions that will be asked after those introductory remarks. And because we are discussing the proposal of the reopening of Cape May County, I am not going to ask specific questions that were about individual municipalities. And I'm also going to ask that when we get to the opportunity to ask individual questions at the end of the introductory comments, I'm going to ask that you also not ask specific questions about individual municipalities. And so with that, I'm going to introduce our speakers today. Cape May County Freeholder Will Morey, one of the co-chairs of the county's task force, and also former New Jersey Superior Court Judge Michael Donahue. Freeholder Morey, turn the program over to you for your introductory remarks, and thank you for joining us. Will? And we need to unmute Will.
I wouldn't mind maybe if you kept me muted for the program, but here I am. It's good to see everyone, and I think we're all looking forward to being together, other than on Zoom. But appreciate your involvement today. So, I'm really delighted to have been a part of a group that was that came together to form consensus about how to address this issue of COVID-19, certainly in our community. We know that it's being dealt with around the world. This is difficult for everyone. There just is almost, I think, no one that's not adversely affected by this, whether it be health issues, social issues. It just runs on and on again. This has been a great disruption. Certainly it's an economic disruption, but I think that the level of the impact is certainly something that this world has not ever seen. So everyone knows that, I know, and we come to a point where we say, okay, how do we move forward from here? Fortunately, I think that in large measure, the response worldwide, and certainly New Jersey, was to hit it hard, so to speak. There was not a lot of information. The virus is extremely contagious, as we know. Our health system was under sort of attack. Capacity was compromised, and swift action needed to be taken, and I'm thankful that that action was taken. as we learn more and as we move forward, I think that the conversation has become about, just that. How do we move forward together? How do we shift from what was a single source strategy of isolation and essentially quarantine, things like that, into a dual strategy? And I'll call that strategy one of living and functioning safely in the time of COVID. So when we got together, originally the freeholders identified the need for a task force focused on recovery. We knew that there would be a substantial economic impact. I don't want to use the word devastation. Hopefully we'll get beyond that. And so a task force was formed. It didn't take long, like a couple of days, to realize that a typical task force structure probably would not be workable, in that a group of business members providing guidance to municipalities and to the freeholder board, it was too much of a one-way, singular focused sort of approach. So we very quickly shifted the task force concept into the recovery initiative, and we decided to identify it as the Cape May County-wide recovery initiative. So in doing that, it was all about consensus. There are so many opinions on this topic in terms of how we should all move forward to deal with it in a safe way, to deal with it in an economically sustainable way, et cetera, et cetera. So the task force became the business sector voice. We immediately brought in the health sector, which is Cape May County Health Department and also Cape Regional at one section. So we have the health sector. We have the municipalities, the mayors and the administrations of 16 municipalities, critically important because each of the municipalities has a sort of frontline responsibility as it relates to any sort of opening plan and recovery plan. And then of course the freeholders were engaged as well. We wanted to make sure we had a system that would receive inputs. So we have an input mechanism where folks could put their thoughts. And this was all built around a center objective, which was reaching consensus. And the notion was that we're much better off trying to reconcile differences and trying to come up with a plan that was a consensus plan to represent to the state than to have varying thoughts and opinions that are competing for attention from the state. So I think the process worked really well. I'm very thankful for the team that has participated. And again, that's all 16 municipalities. That's the Freeholder Board. That's a number of really outstanding members from the business community, health sector. And Mike Donahue, I want to thank you for early on raising your hand. Uh-oh. That's not good. You guys still hear me or am I gone?
So I'm noticing lots of people in the chat saying no audio. I can hear everyone who has spoken so far from my end. And so I am hopeful that, the audio is also being captured on our recording, which we can circulate to anyone that's having trouble with the audio. And Will, it does seem like I'm getting a notification that your bandwidth is low from your end. So my recommendation would be if there's someone else in your household that's watching or using the internet, that they log off so that you can have more of that bandwidth.
Okay, I think we did that, so I apologize for that. How am I transmitting at this point?
I heard everything you said.
Well, you've
Yeah,
heard
it looks
before,
like folks in the chat also saying it has improved a little bit. So I think we're on the right track.
Okay, good deal. All right, so I think I was left off saying that Judge Donahue, I appreciate all your efforts. I will tell you that gaining consensus is no small task, especially around something that is this difficult. And I do want to acknowledge everyone that participated and worked towards a consensus plan. That means sometimes that not necessarily everything you think should be done, or it doesn't always turn out exactly as you'd like, I should say, and it's not a competition of intellect. It's really a focus of collaboration and collective IQ. So that plan went up to the governor's office, pardon me. It feels like 3 months ago, seriously, but it was just a week ago. In the morning, We heard back from the governor's chief of staff about 3 hours later, and we had a phone call that evening with the Freeholder board. And I would describe the call. I was actually, we sort of prepped for, a different, we weren't sure what we were going to hear on the other end of the phone. So we prepped for different scenarios, but I was really delighted with the sound. Or can you guys still hear me? I'm hearing that I'm being lost.
Yeah, it seems like some people are having intermittency issues with your sound in particular, Will. So, we can do a couple things here. If you would want to turn off your video, that sometimes frees up bandwidth, or we can have you call in on the phone. Or we can, it seems like some people can hear and some can't. So not sure how you want to approach that.
Let me stop the video, see if that helps. I'm showing that things are wonderful here. I like looking at you all, but let me turn that off here. Okay. So the plan went up to the governor's office. We had a phone call that evening, and it was, I think, a very positive call. I think that I think the governor's office was, I think, aware of the fact that we as a state needed to sort of matriculate to an opening strategy. And I think there was an awareness that public health certainly is critically important, but there's an aspect of public health that is tied to economic health and society's health, all in all. And so I thought that was really positive. We spoke through the plan. I was delighted that they were very complimentary of the plan. They mentioned that they get quite a few plans, and that they found our plan, they were very generous in their compliments, saying they thought it was an A1 plan, and that it was obvious that a lot of thought went into it. We are scheduled to speak again this afternoon, so unfortunately, it'd be nice if I could report further development, but that call's not till this afternoon. So ultimately, the spirit of the call was really great, and the question to me really is, will it develop into a productive interaction that will have a benefit and a pathway for Cape May County and perhaps other aspects of the state. So in terms of the proposal, I think it's been available to everyone to read, so I don't know that I will walk you through it specifically, but I will say that it's very heavily focused on protocols as the next strategy. So there's still a place and an appropriateness in terms of the vulnerable population, in terms of protecting the vulnerable population. There's a level of stay at home, I think, that is appropriate for many individuals. But I think it's clear that there are also strategies and protocols that would enable us to start to crawl and innovate and stumble a little bit and walk towards an opening here in Cape May County. So in our view, it's a balanced approach, it's a thoughtful approach, and the focus has been, as is evidenced by the plan and a few of the dates that we put out, it's not about rushing, it's about, from an economic perspective, building a ramp to safely get to what is really our core season. So fortunately, the timing is such that we think that is doable. Had this outbreak occurred 2 months later, it would not be doable. And we certainly would have preferred it to be earlier, certainly preferred to not be at all. But we think that it's a reasonable plan from that perspective. So I know we're going to be looking to take questions and all, but I want to, at this point, Mike, ask you please to add your comments to this.
Thank you, Freeholder Morey. Will, I think, did a great job of outlining all of that. I know people are anxious for more information. I think we should stress at the outset that the governor will make most of these decisions. So what the vision was at the beginning here with Freeholders Morey and Desiderio was, how do we get in the conversation? How do we supply information to the businesses and people of Cape May County? And what came together was this broad consensus that's never easy to do. Of the mayors, the business community, the health sector, the freeholders, to submit a proposal to the governor to try to advance our cause. Sometimes we get a little lost down here in Cape May County. And we were very effective in doing that, which is fantastic. even to the point that our proposal was discussed in the governor's press conference a few days ago. So we are in the conversation. I think the freeholders have done a tremendous job in advancing and advocating for Cape May County. A couple things to understand that some people have been confused about. As Will said, this is a proposal. This is not the plan, at least not yet. We hope that it will become the plan, at least parts of it. But at this point, it is a proposal to the governor. Also, as you all know, what we're doing, what you have done, what we'll have to do has literally never been done before. So there's no playbook. There's no guide. We're trying to put that together as we go. And as Freeholder Morey indicated, we all have to get used to this word protocol, mitigation protocols, because they are going to be part of our lives for some time. You look throughout the world, these are being implemented as a mechanism to try and reopen as safely as possible. So to that end, within the proposal, there is an appendix with a whole bunch of protocols that will cover various industries, sectors, types of businesses. There are links to the CDC website as well, which has a lot of protocols that may cover your business. So I agree with Freeholder Morey. I want to thank him for his leadership in this. There's been no idea that he didn't entertain, no position that he hasn't advocated on behalf of Cape May County, as well as Freeholder Desiderio as the co-chairs of the Recovery Initiative. So again, we're doing our best to advocate, but many of these decisions will be up to the governor in terms of when businesses can begin to reopen. Thank you.
I think we're ready to jump into some of the questions that have been submitted.
Vicki,
and I'll just start.
Vicki, just
Yes.
before you ask the first question, I just wanted to let folks know that it appears we received word from our friends who are watching on Facebook that the audio is working perfectly over there. So anybody who on this call is having trouble hearing the audio, I would suggest that you hop over to the Cape May County Chamber's Facebook page and watch the session live from there.
Okay, that's great. So the first question is, there have been a lot of mixed messages from state government, county government, and municipal government. I am confused at which part of government to follow. Also, we have instituted all of the protocols that the county has laid out in the document they sent to the governor. But when can we actually start opening?
So I know, thank you. I know Mike will hesitate to give legal advice, and actually won't give legal advice, but so one of the our objectives is to try to get really synced up with the state on this. There are sort of countervening sort of messages. The county and the municipalities have been given essentially authority over rentals. For example, the county was given authority over seasonal and short-term rentals. The municipalities over beaches and boardwalks. Yet one is asked, well, that's the case, but is there a stay-at-home order that's still in a place, a non-essential travel, non-essential worker? So there's definitely confusion. Our hope, and I'd like to raise that on our call today, is that we'll start getting these these various sort of conflicting messages sorted out. I would think that is inevitable to occur. We've heard the governor talk about how he couldn't imagine that the beaches wouldn't be open for Memorial Weekend, certainly according to social distancing standards and the like. And I can't imagine that he was referring to only individuals that live in those communities that are going to go to the beach, but in fact, the others that will inevitably come down. So we're still 10 days away or so from that, but I'm hopeful that this week we'll get more guidance as to some of those mixed messages. And I have to agree, it was difficult as we worked through this to really sort of chart a course, knowing that existed, but we knew that would all have to come together ultimately as an opening plan started to be formed. Mike, you want to add to that, please?
Yeah, there's been a lot of questions about Executive Order 107, the so-called stay-at-home or travel ban. But alongside that, the governor did not shut down access to second homes. He's talked about people going to the beach. So everyone will have to make their own decision sort of with regard to how they view the travel ban. It has a lot of exceptions built into the executive order, and there are at least implied exceptions by the fact that rentals were left in local control, beaches and boardwalks were left in local control. And as Will said, the expectation you would think is that people are going to travel to go to those places. So as I said, as Will said, I can't give legal advice to everyone here, but it appears that there is at least implied in there an understanding that some people will go to the shore. So it's going to be up to each individual to make that decision, but there's not, it's one of many areas that I'm sure you are all as frustrated as we are, that there's not real clarity. And that's a challenge, I'm sure, in Trenton to try and keep on top of these things and keep them moving as situations develop. So unfortunately, we don't have the clarity on that we would like to.
We'll raise that today, though. We should have the opportunity to do that, and maybe we'll at least learn what their timing is for trying to sync these various aspects up. I will say that we really endeavored in this proposal to gain credibility by showing reasonableness, not only a quality plan with appropriate protocols and implementation strategies, but also a timeline that we think made sense. Once again, trying to build the ramp to to the core season. So, our short-term rental recommendation, and in fact, the county's recent resolution was for less than 30 days hotel stays to start June 1st. And that starts with a capacity constraint of 60% for the first 3 weeks.
Okay. So the next question is, how can people socially distance themselves on the piers with tremendous crowds?
So I think that we have developed and are still working through capacity management systems. So part of it may be, for example, on a boardwalk pier, speaking from our business, we're looking at a number of strategies, including limiting the number of folks onto a pier. I think that the guidance is clear. I'd like to see the guidance be a little more clear as to masking and how that affects social distancing without masking, so to speak. So we're going to take some guidance from that as well. Ultimately, I think beaches have looked at how they might address capacity limitations. Certain beaches certainly are larger than others, so that's more of an issue for beaches. The Wildwoods, for example, typically have much more beach to utilize. Others have less. So I think it's an issue of capacity management, where that can be done, and protocols that need to be in place to keep appropriate distancing, masked or unmasked. I think we're going to find that we're going to be in a masked environment, a face covering environment for several weeks. That would be my sense at this point. So I think that's sort of part of the strategy as well.
Okay. The next question is, in a time where the media seems to portray the decline of COVID-19 cases, the arguments that the fatality of the disease is an insult to the tens of thousands of lives already lost to it. How do you justify endangering more lives by reopening?
So there's the science is just all over the spectrum on this, right? It's not, so I don't really accept that we're endangering more lives by opening. I think that the focus is, how we live and manage with COVID. And our view is that protocols can be put in place to safely function with COVID. So we're seeing a number of states in the opening process now. We're certainly learning from those states. We're seeing, I think, some good results in that at this point in time. But I think at the end of the day, I think from a society, certainly from an economic health standpoint, the current strategy is not sustainable, and I think our view has been that businesses will innovate and contribute to the solution. Businesses have an uncanny ability to find a pathway to survival. And when they understand the rules of engagement, they do a pretty good job of finding how to live within constraints, how to follow safety protocols, and innovate themselves into a point where they can, I think, at least survive. But it's not just about business. I mean, you know, we're all hearing it. Folks want to return to some level of normalcy. There will be a near normal, I think, time frame in all of our lives for quite some time. But there are a lot of other health aspects as well that really, I think, aren't being talked about enough. My wife was referring to, you know, folks that aren't getting mammograms now, and just all the different preventative treatments and that are so important, you know, to our society. And we know that there are issues with, unfortunately, very unfortunately, with spousal abuse and child abuse and alcoholism and all these different aspects. You know, they are important. They are a part of the overall health, I think, metric, and I think they're recognized as existing, but they're not being, you know, focused on. So I think it's protocols. Part of our plan is to really to ramp up testing. We think testing in the county is important, and trying to build the number of tests. We're working closely with the health department and with Cape Regional to dramatically increase our testing regimen. So I think all of this, I think comes together to I think appropriately manage health risks to individuals.
Thank you. The next question we have was actually a question for the chamber, and that is, what is the chamber doing to ensure the safety of business people and tourists? And we have been posting protocols and guidance documents on our website and offering additional educational resources to the business community in order to be fully prepared when reopening does happen. And additionally, for our visitors, seasonal residents, and second homeowners, we are using our website, social media channels, and newsletters to keep everyone informed on best practices with local updates for a safe and responsible visitor experience. So we encourage everyone to visit CapeMayCountyChamber.com, subscribe to our newsletters and our Facebook page, our Instagram, so that you will be getting all of these updates as we get them. And also in the proposal for reopening, a lot of these guidance documents were included in that. And as we receive new industry standard protocols, they're being added as well. So everything that is available is being pushed out to the business community through every possible means. And if you have any questions about that, we encourage you to contact the chamber, or of course you could email county government. I know Leslie Gimeno is on the call, and she has been fielding a lot of this information as well on behalf of the county to provide all that information to the business community as well. So, you know, we want to make sure that everyone gets that information as quickly and completely as possible.
Vicki,
yes.
I just want to, you know, thank the chamber for the good work you've done in terms of communicating and sharing resources, because ultimately, you know, we've all probably recall the commercial or whatever it was. There's making the proposal and there's doing the proposal, right? And we're moving into a phase of trying to work in partnership to see that these protocols are being implemented and being followed and utilized. And it's really the work that you all are doing with the other chambers and industry associations is going to be really important for that.
Thanks, Will. I think partnership has been really one of the key reasons for the success that we've been having on these webinars and so many others. So let's move on with these questions, because I see several raised hands and we want to get to those questions as well. The next question, how will Cape May County reconcile the governor's stay-at-home and essential travel only with reopening proposals?
Yeah, I think I touched on that before. We'll raise their attention, the front office, as it were, their attention to this issue, and see whether or not we can help influence them to reconcile some of these conflicts.
Okay. What will happen if people aren't compliant? If the number of coronavirus cases sharply increase after opening, what action will the county take? Does the county have sufficient numbers of healthcare workers, adequate supply of PPE, and hospital capacity?
So I think that, so a key aspect of this, once again, is this is not just a, let's just all get back to normal do things the way we used to do them, life, right? So a key to this proposal and the strategy is, are all the CDC guidelines, are these protocols? So, I mean, ultimately, we're relying on that to be the case. We're focused on not only what we just spoke about in terms of sharing of these protocols, but also in messaging. The county's looking at a plan now to really push out messages for compliance on all these protocols as well. We're also looking at supplementing the communities with additional be able to work in the communities and to observe and encourage folks to be following these protocols and to following these guidelines. At the end of the day, this has to be a team effort. And if anyone who is not invested and serious about following these protocols really jeopardizes, jeopardizes the situation from all of us. In all of our conversations, with the health department, there is a comfort level in the health department's part in terms of this plan and moving forward. I think that there is the identification that CDC guidelines on not only distancing, but face coverings and things like that are all something that will need to be followed. I think the testing regimens that we're speaking of is also an important part of it. I think that the hospital system here really works on a regional basis. It's not just Cape Regional, but we've got Shore and various other hospital networks. And our sense is that the capacity of this system and the other systems that are part of a response are in fact adequate to respond to this. What we do not want to see happen, of course, is a spike that causes folks to go back to a shelter-in-place and go back to a shelter-in-place environment and sort of recloses the economy. But from our conversations with all sectors, I think there's a belief that this plan is a plan that we can move forward with, and we can respond to if we have adverse consequences.
So, Will, my last question before we go to the audience questions is about second homeowners and talking about, at this time now, are second homeowners welcome to come to their homes here in Cape May County?
Yeah, sure. I mean, look, I think that very early on, once again, I think the strategy was freeze, stop everything, stay at home, and let's try to get our hands around, so to speak, the contagiousness and the spread of the virus. So I think it was appropriate for Cape May County to encourage or ask the second homeowners to please shelter in their primary home, as did the governor. But I think as a part of, we are seeing already a great number of second homeowners come into the community. So I don't know what our actual population is now, but I wouldn't be surprised if it's near double what our year-round population is, even at this point in time. But so I think the message is, yes, they are welcome. We certainly have an expectation that they, as well as our primary residents, follow these protocols. This is a sort of a safely together thing. We need to walk forward, but we need to focus on and respect the need for these protocols, encourage and to a degree enforce them as well.
Well, Nina, would you take the first question, please?
I surely will. So I had seen that pretty early on, Mary Kimball had raised her hand. Mary, if you still have a question for us, please go ahead. You're unmuted. Mary, if you're there, we'll just give her one more second.
I was interested in the availability of the beach and of swimming for tenants.
Sure. So my understanding at this point, and if I'm unstable here on my voice or video, audio or anything, I'll ask Mike to take this. But the currently the beaches are open. Mike, you might have a better inventory of this, but they're open.
I'm sorry, I mean to step on you.
No, please go right ahead.
Okay, so obviously the local municipalities have control over this question. The beachfront municipalities have all looked at it, and as I understand it at the moment, they've all opened for active recreation, which means walking,
Right.
jogging, those kind of things. There is a progression expected with a full opening not before June 1st. However, some of the mayors I've spoken to are working with their beach patrols to see how they can handle swimming as an active recreation item. So we can't give you an inventory of which town is doing what and when on that specific question. You'll have to check with your local town. Some of them will probably open for swimming maybe a little sooner than others, depending on how many beach patrol folks they have available, and what their plans are to sort of spread folks out on the beach. So unfortunately, we don't have an inventory of that, and I think the towns are still working through that, how best to make that happen. So you should check with your local government and see what their plans might be, okay?
Our encouragement to the governor's office has been that June 1st be the time when beaches are open for sitting, appropriate social distancing with that, but for sitting and sunbathing and things like that. But prior to that time, you know, our encouragement was that they're just in the active use.
Okay, Mary, thank you for your question. And our next question comes from MS Brown Jewelers. Go ahead, you're unmuted.
So the PPP, can we ask questions about that?
Go right ahead.
So I actually asked Crest Savings Bank some questions and they couldn't answer. They have to get back to their representative. But the PPP that I signed, at least with that, is anything retroactive back to the 15th, which was the contract that I signed, such as my people have not taken payroll, but they're still on my payroll. So am I able to retroactively go back to my payroll as of 6 weeks ago and pay my employees on the PPP?
So this is a very complicated area. And I'll tell you what, we do have subject matter expertise within our company, and I'd be happy to reconnect with you on that. If you could shoot me a phone number or email, and we'll do the best to give you at least what we've learned. My sense is that you do have flexibility for that, but I don't want to give you sort of bad advice on that. We've been all over this. We can at least offer our perspective to you, in addition to what you're hearing from Crest.
Thank you.
So just, yeah, shoot me a phone number, and I'll make sure that one of my colleagues gets a hold of you. We'll share whatever we know about that.
Thank you for your question. Our next question comes from G Small. Go ahead, G Small.
Yes, hi. We're a hotel, and thank you very much, everybody, for everything. Really appreciate your time spending with us. We are a hotel, and will our business, as we welcome people in, be required or need to provide a preparedness or action plan prior to opening?
Yes, I believe that you will, and there are really good protocols that have been provided by the New Jersey Hotel and Restaurant Association. I think they're embedded as a part of the plan. Anina, I think you could maybe confirm that.
Yes, we have, suggested protocols for each industry as part of an appendix to the plan, as well as links within the plan to anything published by the relevant industries.
But there's no question that you should have a plan in place, whether it is a best practices plan, which you can expect will continue to evolve over time. We're seeing that, this document that we put together, and I think these protocols are living documents. And I understand that the legislature is considering certain protocols for hotels as well. You want to pay attention to that. There's a bill that is just been being considered that should surely have your attention.
Can I jump in on that real quick? I think the word required is a tough word at this point. There are recommendations at this point, but I think Will is right that by the time we get to that date of June 1st for these shorter term rentals, in all likelihood, there will probably be guidance out of Trenton for what hotels and motels will have to do. What we're trying to do is give you a head start on that by supplying these protocols, and the industry has done a tremendous job in preparing those. So at the moment, those requirements are still being worked on, as we understand, in Trenton, but you should be prepared by the time that you can open, that they will be, there will be guidance that will probably be mandatory, and it will be much along the lines of what the industry has put together. And I understand that the governor's office has seen those and likes them. So definitely get started on that protocol, and you can find it online, and the chamber has all those protocols available as well.
I'm hard pressed to think of a business that won't be functioning differently than they have in the past. So it's important to be prepared.
Thank you for your question. And our next question comes from XYZ, quite the mysterious username. Go ahead, XYZ, if you're there.
Hello. I own a few retail businesses in the county, and I read over the advice, and it didn't mention any of the plexiglass barriers that we're seeing in, the banks and box stores. And I just wanted to make all my purchases and orders early on so I could be prepared to reopen. Has there been any discussion of adding that to the list of requirements?
That's a really good question. It would seem to me that would be consistent with what we're seeing in some of the other protocols. So I think we ought to reach out to our retail partners and subject matter experts and inquire about that. So I certainly think that's an area that should be discussed and addressed. I can't suggest, or I don't have the knowledge or background to say whether they should or shouldn't be incorporated. But we'll reach back on that.
I believe in the Retail Federation document, there was some information about that. And I believe that document is on our chamber website, which we had just received.
Okay. Well, we should make sure we get it into our protocols on the opening plan as well. Yeah.
Thank you for your question. Our next question comes from Shannon Vale. Go ahead, Shannon, you're unmuted.
Good morning, everyone. I just wanted to ask a question about the wedding industry. There's not been any specific language about the wedding industry in the proposed plan, which really affects not only venues, but hotels, short-term rentals, B&Bs, restaurants, and wedding vendors such as florists, musicians, DJs, and photographers, bakeries, and planners. Not to mention the couples who have planned months for their weddings. So if restaurants can open at a percentage of their maximum capacity, can wedding venues do the same? And if so, starting when and with what restrictions?
Yeah. So that falls under, Mike, please join in here, but under the social gathering aspect, we really did not engage in the concert and public gathering events at this point in time. I think that it certainly makes sense to pursue a sort of capacity management plan as it would with restaurants. And it's something
so I think, yeah, I'm sorry.
That's all right, go ahead.
I think part of the approach, and we should make this clearer, obviously, and we will. 2 weddings was that weddings will be associated with a venue, right? So there will be a church maybe, or a hall where a wedding takes place, and those types of facilities are addressed. There will be a reception venue at a hotel or some other facility, and again, we address those facilities in this proposal. So it would not be a difficult thing to sort of kind of pull that together under the heading of weddings. But what everybody who performs and is involved in catering and putting weddings together should understand, again, those decisions on when you can start to have weddings again and put those together are coming out of Trenton. They're not coming out of the county of Cape May or your local municipality. So the guidance right now from the CDC is everybody stay 6 feet apart and gather in groups of no larger than 10. That obviously makes it extraordinarily difficult for the folks who put weddings together. The governor has, on a couple of occasions and press conferences over the weeks, been asked those. I believe at least once I heard him talk about when we could do weddings again, and the answer has been that it's a difficult question because in the proposal you will see when we talk about bars and restaurants and even retail, where the goal is to attract as many people as you can to your establishment, are going to have extraordinarily challenging weeks and months ahead, and they're going to be capacity control issues, et cetera. So that's not trying to dodge the question, but the ultimate decision on when weddings can recommence at some level of normalcy will really be up to the governor. And like everybody else, there's hope that will happen soon, but that is really out of our control. If you look at restaurants and bars and other facilities, you get some idea of those capacity questions, and hopefully weddings will be able to move along as those places reopen.
We've made recommendations on a number of issues, and certainly, Mike, we can sort of take a step back and see whether or not we can formulate a recommendation in that area as well. It's sort of piggyback into restaurant capacity and things like that. So,
right.
Okay.
Thank you, Shannon, for your question. Our next question is going to come from, looks like Jeff Woolery. Go ahead if you're there.
Yes, very much. First of all, I really want to really appreciate the efforts that this team has put in. I think you've done an amazing job in a short period of time of getting some really good, as you refer to, protocols in place, and I really want to thank you for that. My question is regarding the use of the word protocol, which can be, I think I just heard more recently, moving from a guideline to some time a requirement. The question is this: assuming we put some of requirements for what we're talking about, how's that to be enforced? Because having a requirement is one thing, for it is another. We're seeing cases now in multiple states where people are not following the guidelines at all. The pictures coming out of the Naples beaches recently. And the beaches in particular, we have lifeguards, beach tag checkers, and so on that are teenagers, sometimes early college. Are we going to be looking to them to enforce these? So that's a question I have for you.
I think I picked up most of that. Mike, did you pick up that question? It was a little
scratchy.
So. Yeah.
I think it was about enforcing protocols, which is a common question and concern. There are going to be multiple levels of education and reminders. Municipalities are already printing signage and planning to use PA systems, town-wide systems, the sort of robocall, reverse 911 systems to keep reminding people. There will be sort of the gentle persuasion of beach tag checker type person or lifeguard or some other person walking around. The board of or Department of Health in the county is in the process of putting together a corps of social distance ambassadors that will assist the municipalities, and there will be a sort of escalating level of persuasion to enforcement. If law enforcement or Department of Health has to get involved on a greater level. Now, for every story of non-compliance from some place that is more broadly open, there are stories as well as of people complying and it working. So it's a matter of education, persuasion, and ultimately enforcement if it is necessary. It's also a matter of survival, frankly, as we mentioned in the proposal, of the business itself. Because businesses that decide not to comply, they may end up being shut down if there's an employee who was sick, et cetera. In open spaces and boardwalks, et cetera, the CDC guidance is stay 6 feet apart, groups of no more than 10. And if you can't effectively stay 6 feet apart, then wear a mask. So some of these photos we see of people on the boardwalk not wearing a mask, that it may not be that they are that close together, but we will be encouraging everyone to have their mask with them, to wear it in public. But some of these places where you see a couple people walking down the street that don't get within that type of distance of each other, the CDC guidance is it's okay with regard to the face covering. But if you have a section of the boardwalk where people are packed in tighter than 6 feet apart, everybody should have a face covering. So there is an educational plan beginning and will be implemented very shortly, and that type of persuasion will be brought to bear. And you know, we will do everybody from, you know, the locals to the counties to the state to federal officials will be pushing this message. And it's not just us. We're not alone here. This is the entire world that is now engaging in this effort to institute these protocols. The United Kingdom came out with a 50-page plan yesterday that is heavy on the protocols. And this is what's happening. This, if I can just real quickly, there have to be more than 2 positions, right? One is just stay locked down kind of until everybody's immune, or just throw the doors open and everybody go back to normal. Neither one of those is really workable. So we're trying to find, everybody throughout the world is trying to find that spot where we can let people get back to some level of normalcy with the highest level of safety possible. That's what this is really all about.
I think people want to be part of the solution. I think we're at a point where you know, folks are. I think people are willing to put up with what might have been thought as being too much inconvenience weeks ago. So, but I think with the right encouragement and planning, I think we're going to see that.
Okay, thank you for your question. Our next question is going to come from Linda Bateman. Linda, go ahead.
I'm up. Hi, thank you. My question is about rental properties and the narrow window of changeover that we have on those days. Is there any guidance, any information coming from realtors, or a lot of properties are individually owned? What's going to be different in terms of making sure that when one group leaves, the next coming is going to be fine? And how will that even be? Is that being addressed some way that I don't know about?
Well, with the realtors, there's been discussion about expanding the changeover time. I think that the realtors that we've engaged with, I think, recognize that more time is needed, and there's an effort on their part to try to gain some consensus in terms of those type of protocols or those type of requirements. Look, I think that I think that the guests are going to ultimately demand assurances of appropriate sanitation and cleanliness plans before they move into properties. So there's no mandate that I'm aware of at this point in time in terms of a changeover time, but what we're hearing is the reality of it's going to take longer to change over, and I think companies are starting to set up to be able to do that.
Okay, thank you for your question. We'll go to our next question from Bob Dreyfus. Go ahead, Bob.
Hi, how are you, everybody? I have to say this whole plan sounds to me like the sheriff in Jaws saying there's no reason we can't all go back to the beach, it's just a little fish. I'd like to know what plans in your protocols, and I understand you've tried to make this as safe as possible, but what plans have you developed for contact tracing, for testing, for random testing, for making sure that the disease isn't slowly spreading both in the local population and among visitors? It takes, as you know, 2 to 3 weeks at least for the incubation period for this to develop. And there are only 14 ICU beds in the entire county. So what kind of precautions and preparations are you making for this not only spreading locally, but being carried into town and then carried back again by visitors who pick it up at various social gatherings here?
So, I mean, I think we've addressed much of this, Bob. It comes down to me to it's an evolution from where we are to an adjunct strategy, and that strategy is living and functioning through protocols and CDC guidelines and social distancing and masking and all those type of things. So I think our view has been that a balanced approach is required. I touched base in terms of the ICU beds. As far as the regional health system, I think we do rely on a regional health system, not just the local one. And as far as testing, I'm not seeing contact tracing as being as effective as a strategy, given the tourism aspect of this community. But I do see ramping up testing substantially as an important strategy towards early identification of of the disease.
Thank you for your question. So I just wanted to note we have 2 more raised hands. We're going to take these 2 and then we'll start wrapping up the program. Oh, looks like only 1. So this will be our last raised hand. This is Chris Vizier from our task force. And Chris, I'm trying to unmute you. There you go.
There we go. I got it. Thanks, Nina. I just wanted to touch base on a couple things real quick. First, a question that Will just addressed in regards to guidelines for landlords and property owners. The Board of Realtors has worked with the task force in putting out guidelines to owners as far as check-in times. And unfortunately, that's something that we can stress to the owners, and a longer check-in time may be needed for cleaning, but as an association, we can't mandate owners do that because we're not part of it, but we are strongly encouraging that. And also to address a question that was asked earlier in the chat room, to help owners and tenants feel as comfortable as possible, we've provided the CDC guidelines for cleaning as well as the county health department guidelines for cleaning, which the county has on that website for recommendation. And I think it's also outlined in the chart that was included with the proposal that we sent up to the governor's office. The last thing I just wanted to address also was, obviously Will and Mike are going to address with the governor's office this afternoon some clarification on the short-term travel ban and what it actually means or how it does or doesn't affect the rentals coming into play. But we also have to remember that a lot of our visitors are coming from states around us that either do not have a short-term or I'm sorry, not travel ban, stay-at-home ban, don't have it in place or will be expiring soon. So even though we do have some visitors in the state of New Jersey where the stay-at-home order is still in place, there's other states around us that it's not. So that's how they will be able to attend coming to the rentals and to the hotels. So just a couple of points I wanted to touch on that I saw some questions on.
Thank you, Chris. Appreciate your work in this regard.
Thank you, Chris. And we have, I have 1 more raised hand that we're going to take here. It is someone that's just on an iPhone. So if you think that's you, go ahead and see if you're unmuted, iPhone. Okay. Seems like that person is not there. So I'm not sure if we want to go ahead and make any closing remarks or how we want to wrap up.
Yeah, I think we're up on our hour here. I don't know, Will or Judge, if you have any closing remarks you wanted to wrap up with.
Michael, go ahead. I'll follow you.
Look, we have throughout the proposal said that we have our first eye on safety. Everybody throughout the world is trying to figure this out, and we are going to find a way to do it that keeps everybody safe and institutes what we've called protocols that emulate stay at home to the extent that they can. Again, what we're trying to do has never been done before. I think we have a lot of people working very, very hard to make sure that this community is protected. All of the freeholders are engaged, the mayors. No one wants anything bad to happen. So we will all have to work our way through this, as Freeholder Morey has said, safely together. And we appreciate everybody's input. It's extraordinarily helpful to have it as we move forward, especially as we head into this discussion this afternoon with the governor's office. So thank you all very much, and thanks for to the chamber for hosting this.
And Vicki, yeah, thank you to you and your team. You've been outstanding throughout our work together, and appreciate it very much. And as I mentioned, really an instrumental part about getting resources out and working hand in hand to have businesses equipped for the upcoming season. Mike, you touched on input. We really are, we're input, thirsty, so to speak. So from this, the time together, any thoughts, suggestions, concerns you have, please send them our way. We want to make sure that we are fully open, eyed and eared, so to speak, about any input that is available. And I do want to thank my colleague, co-chair Len Desiderio, who's been working hand in hand on this, and will be joining us on the call with the governor today as well. So I'd like to just emphasize that this is holistically, this is obviously a COVID crisis, but this COVID crisis has other health concerns, other health ramifications and consequences as well. So when we look at this, to me, we've got to stand back now and look at the whole situation. I think that the explosion, so to speak, has been addressed appropriately, and we now have to navigate the world before us. And the way to navigate the world before us, I believe, and we believe, is to evolve and to have our strategy evolve into a dual strategy system. Economic devastation is fair to talk about, and that's what we're facing here at the Jersey Shore with our short season. It's not an excuse to do anything that is unwise or anything that is not thoughtful in terms of one's health and safety. But I think that this initiative and this group realizes that that when we look at the whole problem on balance, this is an appropriate direction to move in. I think we're seeing that across the country and other states. And we're hopeful that we'll work in a really collaborative way with the state of New Jersey for the benefit of all. So thank you all for joining. And once again, any further questions or comments, please don't hesitate to send them my way or to the Chamber's way, and we'll do our best to address them. Take care, everybody.
Well, and we thank you for joining us. The interest in today's program is really evident by the level of participation, and we appreciate your time. And I'll turn the program over to Doug for some closing remarks. Doug? Unmute. Yeah, there you go.
Thank you, Nina. Just quickly again, thank you, everyone. Thank you, Freeholder Morey and Judge Donahue, for taking these questions from our members in the business community at large. I think it's obvious to me that Cape May County has a strong voice here, so we appreciate all your hard work and the communication with the governor's office. Also want to thank Vicki and Nina again for the job that they're doing. And again, the Chamber, our role here is communication. That was touched on during the call, so continue to go to our website. We're sending out those daily emails with a lot of good information, so please stay informed. And again, I'm going to close on, thanking our first responders, our healthcare workers. And one thing that's available now through the Chamber website, we have some yard signs. So please feel free to go to our website and check that out and support our first responders. And again, thank you for everyone for being on the call, and we will talk soon.
Thank you.